neuropsychiatric Lyme disease and how a lot of Lyme patients have symptoms like fatigue and brain fog, but also depression and anxiety and even psychosis and rage and things like that. And the big thing that stuck out for me was sleep disorders in Lyme patients. And basically 80 to 100% of Lyme patients have issues with sleep. And that's huge because if you're not sleeping, your body can't do what it needs to do to heal and to get rid of die-off and do everything it's doing to keep you healthy. So sleep is a big one. And there also seems to be this kind of shift in your cycle where people stay up all night and then sleep during the day. And that's common with Lyme patients as well, where their circadian rhythm kind of gets off. And so in this particular presentation, they talked about coenzyme Q10 and how that could potentially be important for things like chronic fatigue, also B12. We discussed some of the typical antidepressants, the SSRIs, and the pharmaceuticals. One theme across this conference was that people with Lyme disease tend to be pretty sensitive to medications, and especially the things like the antidepressants, that some people respond to an ultra low dose. So you might need a lower dose than your typical dose, and you might be able to respond to that and have less side effects that way. Acetyl L-carnitine has antidepressant activity and is also neuroprotective. Omega-3 fatty acids, that came up a lot as well, being anti-inflammatory, helping with pain, helping with brain inflammation. St. John's wort is kind of your more natural SSRI. Then also PEA was discussed, which is similar to cannabis medicine in that it acts on your endocannabinoid system. So that one releases anandamide, which is your natural bliss molecule. So that's the molecule that makes you feel relaxed and blissful. So that can be helpful in many ways for people with Lyme. Low-dose naltrexone was brought up for neuropsychiatric Lyme disease as well. And for a couple of other multiple presentations, low-dose naltrexone was brought up again and again. And that's one where I kind of would like to hear your input. Have you tried low-dose naltrexone? Did it work for you? Did it take a while for you to find your optimal dose? I'm seeing like a wide range of doses. Some people start as low as 0.5 milligrams or even 0.1. Usually about 3 milligrams is the typical dose that you shoot for, sometimes 4.5. I've seen higher. I'm just curious if you have used it, if it's helped, and how long it took you to find your optimal dose, what your optimal dose was. For me personally, low-dose naltrexone was a game changer. It just helped me with energy. That was like the first time I could actually wake up in the morning, like, wow, my alarm didn't even go off. I'm actually awake. And that usually if I didn't set an alarm, it would be like easily 2 in the afternoon. I wouldn't wake up till my dog needed to go to the bathroom and she would wake me up, basically. So for me, low-dose naltrexone was a game changer. I hear a lot of people that love it, and I also hear a lot of people that say it didn't do anything. And so it seems to be tricky on the dosing. So just curious what your experience is with low-dose naltrexone, if you want to share that in the comments. And then we also discussed the keto diet briefly, how the keto diet increases GABA, which is your neurotransmitter that helps you relax. And that can be helpful for patients that are experiencing psychosis and schizophrenia. So keto diet, not right for everybody, but does have its place, does have its benefits.